After evaluating both your leg and your back pain, I think you would be a really good candidate for physical therapy. I think you have lumbar radiculopathy. So basically, your spine is made up of these little bones that are kind of stacked on top of each other, just like this. And in between those bones, you have these little discs. And on the sides of those structures, you have nerves that kind of poke out and go to the rest of your body. Sometimes when we do certain repetitive motions, we can cause those discs to kind of squeeze down on those nerves a little bit, and it kind of causes them to get angry at us and give us a little bit of pain. So some of those activities that can do that are sitting for long periods of time, lifting heavy weights, or even just a repetitive forward bending motion, which are actually a lot of the things that you do with your job. So I think that coming to physical therapy 2 to 3 times per week for 6 to 8 weeks would be really beneficial for you and would help to get rid of some of that back and leg pain. During these 6 to 8 weeks, I really want to be working on some range of motion, some of your strength, and also really focusing on trying to open up some of that space in your back so we can kind of take some of the pressure off those nerves and hopefully make them not as angry at you anymore so that they won't cause you as much pain. What we're going to be doing today is I'm going to be sending you home with 2 exercises that I want you to do. The first one is called a prone press up. So I'll demonstrate here for you. What I want you to do is I want you to get on your stomach, just like this, with your hands kind of in the push-up position. And while keeping your hips and your legs on the ground, I just want you to push up your upper body off the ground and extend your arms all the way and hold here for a second. And then come back down. Okay, and with that exercise, we're going to be doing 3 sets of 10, 2 to 3 days per week, with 45 seconds of rest in between. The next exercise that we're going to be doing is something called lumbar extensions. And this requires you to put your hands on your hips, kind of like this. You'll be standing up. And what you're going to be doing is you're going to be bending backwards at your hips, just like this, as far as you can go. Hold it for a second and come back to neutral. Okay? Same thing for this exercise as well. We're also going to be doing 3 sets of 10, 2 to 3 days per week, with 45 seconds in between those sets. And both of these exercises should really help to relieve your pain, but if for some reason that they cause you pain, I just want you to stop and I want you to let me know next time I see you. Something else I'm also going to be doing is I'm going to be referring you back to your primary care provider. I'm just a little bit concerned about your blood pressure. We found it to be a little bit high earlier. So just to be safe, I'm just going to be sending you back there just so that they can be up to date with your medical history and just so that they can make sure that there's nothing more serious going on. I also know that you had a couple of concerns. The first one being worried about having back pain at your age, but I want to assure you that it's completely normal to be having back problems at your age. The average age for this type of back pain is actually between 30 and 40 years old, which puts you right in the middle of that range, so it's completely normal. The second concern I know you had was maintaining your job and wondering if the symptoms could possibly come back. Given that your job has a lot of that sitting and bending forward repetitive motions that we talked about earlier, there is a chance the symptoms could come back. However, I just taught you 2 really great exercises that would work really great to help relieve some of that back pain. And over these next 6 to 8 weeks, I'll also be teaching you a few more that you could use if ever that back pain were to reoccur. That's all I have for you today. I have your 2 exercises printed for you on a piece of paper up front that you can take home with you to make it easier for you to do. And that's also where you'll be scheduling your appointments for the next 6 to 8 weeks that I'll be seeing you. So if you don't have any more questions, that's all I have for you. Thank you.